Today on Investigate TV Plus, billions paid by companies accused of fueling the opioid crisis. I'm Tisha Powell.
And I'm Lee Zurich. That money meant to offset the impact of addiction, but some families affected have concerns about where the funds are going.
Plus, one mother's fight for her son's education.
It's supposed to be a federal program. It's supposed to be uniform. It's supposed to be services that they are entitled to have, nationwide.
We take an in-depth look at the federal law that gives students access to a public education and why it's applied differently depending on where you live.
And two old friends live, laugh, and air their own special brand of wisdom.
If you can avoid it, don't step in it.
Then you can say, I told you so.
In-depth stories that inform and inspire. You're watching Investigate TV Plus.
Drug overdoses have ravaged urban, suburban, and rural communities in every state. According to the National Institute on Drug Abuse, there have been 400,000 deaths in the past 2 decades, and more than 2 million people are currently living with an opioid substance use disorder.
The CDC says overdose deaths remain a leading cause of injury-related deaths, and a majority of those involve opioids.
The prescription opioid industry has so far agreed to pay state and local governments more than $50 billion to settle a number of lawsuits related to opioid addiction and overdose deaths.
States are supposed to spend at least 1/4 of their settlement funds on opioid remediation, but as investigator Carice Jackman found, it's not always clear how the money is being used.
Everywhere you turn in Jacqueline Lewis's home, you'll spot pictures of her son, Sean.
He loved taking care of his family, and he had a heart for people that were broken because he felt broken.
Broken because for 20 years, Sean battled substance abuse.
I just watched him every day get up and fight to live. He was fighting just to live.
For 2 decades, Sean battled addiction, but that ended in October 2022 when he died of an overdose. At the time, his daughter, Ava, just 7 years old.
I have to watch her on days where she's curled up in a fetal position crying, wailing, because she wants her daddy and he's not here.
After losing her son, Jacqueline is now raising her granddaughter. An overdose also took Ava's mother's life. 2 parents' deaths impacting the life of this little girl.
And I know it's going to progress as she gets older. She's going to have a lot more questions. There's going to be a lot more to explain to her when she's better able to understand it.
Sean's substance abuse centered around opioids, the class of powerful pain-reducing drugs responsible for the majority of overdoses, sometimes prescribed by doctors, but often bought and sold illegally on the streets or online. According to the Centers for Disease Control and Prevention, more than 500,000 people have died of drug overdoses involving opioids since 2010. Sean was originally prescribed an opioid for scoliosis pain.
In middle school, the doctors started prescribing him pain medications. We didn't know they were addictive at that time.
Stories like his have fueled thousands of lawsuits against opioid manufacturers, distributors, and retailers. So far, those lawsuits have resulted in industry changes and more than $50 billion in settlement dollars that will go to state and local governments across the country. But after that, exactly where that money is going can be difficult to pin down. Governments can offer greater transparency, but our partners at KFF Health News and an attorney at opioidsettlementtracker.com found few efforts to do so. According to their analysis, only around 1/3 of states have promised the public detailed reporting of where millions of dollars are going.
From a public health standpoint, community members should be educated about what's being done with the settlement monies before they roll out.
Diana Fishbein is a professor and researcher at the University of North Carolina. She and other experts say one of the best investments communities can make with the settlement money is in youth prevention, starting early and addressing the root causes of addiction, such as trauma, food insecurity, or lack of access to health care.
Historically, it's been dramatically underfunded and underappreciated, and that contrasts with the data that's been amassed in prevention showing how potent it can be.
But what researchers suggest isn't necessarily playing out in reality. When InvestigateTV and KFF Health News look for examples of how local governments are approaching youth prevention, we found multiple examples of settlement money going to a program that's been criticized in the past.
Now we're saying no to drugs.
The Drug Abuse Resistance Education Program, or DARE, emerged in the 1980s, with law enforcement educating kids on resisting drugs. But studies in the 1990s cast doubt on whether DARE actually worked, and now some critics question whether that money should be going to the program. DARE reworked its curriculum in the early 2000s to address the concerns.
It's more student-based than instructor-based. Is one difference.
Instead of framing drugs as a scary thing for teens, Francisco Pagueros, CEO of DARE America, says the new program includes the students in the conversation, like role-playing, and talks about how their decisions will affect their health and families. Do you think this is a good use for the money?
Yes, it can be, if it's approached correctly. It's if you're looking to just spend money, it's not going to be productive.
DARE isn't alone in getting money for drug education. Opioid settlement money allowed this program, called Project Success, to expand to nearly all public school districts in Rhode Island. The program, which, like DARE, also started in the 80s, trains professional counselors in addiction prevention education using sessions like this and places them in public schools. But Project Success goes beyond the classroom and simply teaching. Counselors also work one-on-one with students, including those who are at high risk or currently battling substance issues.
What's her favorite shirt he wore?
Back in Ohio, Jacqueline says she worries the money won't be as productive as it could be, and she's been pushing for caregivers like herself to have a voice. But Ohio is one of the states that has been criticized for not including the public in the conversation.
My concern is that none of this money is going to go help impacted families.
So far, state and local governments have received around $3 billion of the more than $50 billion in settlement dollars that will be paid out by opioid manufacturers, distributors, and retailers over the next 15 years. In Washington, D.C., I'm Carice Jackman.
While public reporting can be scarce, the final settlement terms do offer some guidelines on where this money is going. Documents from the largest of the settlements outline what counts as the remediation governments have to spend most of the money on. The list includes categories such as different types of treatment centers, overdose reversal kits, housing assistance, and of course, prevention programs.
Teachers help shape your child's mind, but they can help the healing process too. Still to come, we examine the role educators play in identifying and addressing students' mental health struggles.
But first, students with disabilities should have access to a public education under federal law. But our investigation uncovers why access to special education is not created equal.
You can watch Investigate TV Plus anytime, streaming online. Get the app for Roku, Amazon Fire TV, and Apple TV. They're free to download. Millions of kids across the country are enrolled in special education programs in public schools.
Federal law guarantees students with disabilities have access to free public education with appropriate accommodations, but qualifying can be a huge battle depending on where you live.
Investigator Josie Sturman digs into the disparities.
I got a new dinosaur.
With a couple of pillows, a few chairs, and a lot of imagination, kids can turn a rooftop patio into their very own Jurassic Park.
He's a triceratops.
The Goodwin Brothers don't need much to amuse themselves. With their creative minds, they are the entertainment.
Well, it's definitely an adventure having three boys for sure, and they each have their own unique personality.
Those unique personalities carry over from playtime into how each one learns.
Why does dragons love tacos?
But as their mother Edith has discovered, the public education system doesn't always value her son's differences.
I felt like at times, maybe I was failing them as a parent because, I was trying to advocate for them. No matter how hard I tried, it still wasn't helping them.
Edith Goodwin has spent years trying to get help for her boys when it comes to their unique challenges in the classroom, an especially difficult battle for her oldest, Joseph. It took years to get him into special education, even though she says he began struggling with speech delays as a toddler and was later diagnosed with ADHD and autism.
He did want to try. He was making an effort, and yet he wasn't receiving the help that he needed to progress.
But the help Joseph received depended on where they lived. And as the family moved around, Edith got a master class in the Federal Individuals with Disabilities Education Act, or IDEA, the government's primary special education law. It's designed to offer free public education and protect the rights of the more than 7 million students enrolled in special ed across the nation. But Goodwin quickly learned how the law is carried out depends on where you live, with Joseph failing to qualify in New Mexico, requiring a state mediator to get evaluated in Idaho, qualifying with ease in Oregon, and then needing a repeat evaluation in Colorado when the state wouldn't accept the one done by his doctor. That's all before the family returned to Oregon once more.
It's supposed to be a federal program. It's supposed to be uniform. It's supposed to be services that they are entitled to have, nationwide.
But our national investigative team wanted to dig deeper into the problematic patchwork of special education, analyzing the eligibility and evaluation policies from all 50 states, mapping out the differences. We found major disparities from state to state, including how long schools can take to evaluate and place students, with some like Connecticut doing it in a maximum of 45 school days, while children in North Carolina and Washington may have to wait twice as long. We also discovered there are variations in who can assess whether students qualify, what age services cap out, and how states actually define the 13 official disabilities listed in the IDEA.
Need a lot of flexibility, but we also need to have, what is the bottom line?
Anna Brannon has been studying special education for years and is an associate professor at Indiana University. She says states have their own formulas for what qualifies children for special education, and that's just getting children started with services. When it comes to actually meeting the federal law for carrying out what's guaranteed, many states fall short. In a 2021 report to Congress, the Department of Education put more than 20 states and D.C. on a list, noting they needed assistance meeting IDEA for 2 or more years.
Kids are lost when we don't take care of them in schools. If we really cared about this, we would be paying attention to it, and we would be financing it and funding it at the levels it needs.
Moms like Edith Goodwin are well schooled on the need for special education, but she worries what will happen if the family moves again.
They're getting, a great education here in Oregon, but you go to another state, we'll have to do the process all over again.
One of the biggest shortfalls related to special education is a massive lack of teachers. A recent report by the U.S. Department of Education found 45% of schools reported vacancies in special education roles, and 78% reported difficulty in hiring special education staff.
There's also a problem with retention. The Department of Education says a high turnover rate among special ed teachers contributes to this shortage. A study by Vanderbilt University found the reasons for teacher turnover include experience. Teachers are most at risk of leaving during their first 5 years in the classroom. Retirement. A large number of baby boomers are moving toward retirement. And stress and job dissatisfaction.
Coming up, educators play a vital role in your child's mental health. We'll show you how schools provide support and resources to students who may be struggling. Then later, 2 friends inspired to bridge differences through laughter.
There's enough clashing of the minds around it. This is a chance to say, hey, you're a jerk, I'm a jerk. So let's now that we've got that settled, how you doing today? Look somebody in the eye and say, how you doing?
Our in-depth coverage continues. You can get connected to InvestigateTV Plus on all social media platforms.
Mental health awareness is an important issue for all educators. The Substance Abuse and Mental Health Service Administration says educators are often the first to notice a problem in students.
The National Alliance for Mental Illness says 1 in 6 youth ages 6 to 17 experience a mental health disorder each year, and half of all mental health conditions begin by age 14. Since children spend much of their time in school, educational settings offer an opportunity for early identification, prevention, and intervention.
We reveal the ways teachers are working to address your child's mental health and the resources available for parents whose child may be struggling. Richmond, Virginia high school student Chase Evans knows the stress that can come from the classroom.
I mostly focus on what my friends might need and what my peers are wanting because it can feel very lonely.
It's one of the reasons she tries to support friends and peers through her high school's Speak Up Club. It focuses on mental health, education, volunteering, and taking part in a 5K to raise awareness for teen mental health.
Sometimes those reaching out can really change your perspective.
Reaching out and talking are exactly what prevention specialist Devin Alvin hopes kids will do.
Children are far more willing to talk about mental health and things that they're struggling with than any generation in the past has ever been.
She helped implement the Hope Squad in the Medina County, Ohio school system to address student mental health. The Hope Squad is a specific student team trained to listen to their peers and know what to do in a crisis.
Being able to empower them to not only have the conversations but know how to manage them wisely is really what we're trying to do.
The National Alliance on Mental Health, or NAMI, echoes Devin. NAMI says schools can play an important role. Gail Hawk is part of an outreach team to help families who've lost someone to suicide. She says school staff can learn to identify the warning signs of an emerging mental health condition and how to connect someone with care.
Well, one of the things that we've learned is that we can't wait too long. We've got to start earlier in the schools, and we have to not wait until high school. We need to be in the elementary, the middle schools. So I think those prevention efforts need to start very early on.
According to a 2022 article from Harvard University, when students experience depression or anxiety, it affects their mood, energy level, and ability to concentrate. The Substance Abuse and Mental Health Services Association recommends that educators learn more about mental health by taking training to help ensure a positive, safe school environment. SAMHSA also suggests schools teach and reinforce positive behaviors and decision-making and encourage students to help others. It's something Chase Evans is already doing with her classmates. She wants them to know it's okay to talk about not being okay.
Being able to ask for help and being able to be vulnerable and being able to say, I'm not doing okay, will you talk to me, whether that's a friend or whether that's medical help, from a doctor of some kind.
The Centers for Disease Control and Prevention found the same strategies that promote mental health, like helping students feel connected to school and family, help prevent a range of negative experiences like drug use and violence. The CDC also says strong bonds and relationships with adults and friends at school, at home, and in the community provide youth with a sense of connectedness.
Up next, old friends inspired to make it up as they go along.
And if you have a question that we don't know an answer to, we'll just make stuff up.
We'll share their light-hearted view on life and maybe even have a laugh. You can watch Investigate TV Plus anytime streaming online. Get the app for Roku, Amazon Fire TV, and Apple TV. They're free to download.
If they're out shopping by themselves, they're either one, hungry, or two, they have some money.
If you are hungry for advice that won't cost you a dime, Savannah, Georgia is the place to be.
Chicago natives Kevin Schatzberger and Raz Jenkins are self-proclaimed old farts.
These two friends sit in the park on weekends and dispense their vast wisdom and a few laughs to anyone who's willing to listen.
Reporter Sam Bowman stopped by their booth to see what all the noise was about.
The Forsyth Farmers Market always seems to draw quite a crowd, offering anything from fresh produce to art, and now, old farts.
What advice do you need?
handing out advice at a reasonable price.
Our advice is free, right? You get what you pay for. So you get absolutely nothing.
We don't know squat.
These old farts, better known as Kevin and Raz, have spent the past couple weekends right here,
gracing Savannah with our wisdom.
And it would appear they have plenty of wisdom to go around.
Always go to class and sit up front.
The words of wisdom are do what you love and love what you do.
If you can avoid it, don't step in it.
Then you can say, I told you so.
I gotta take a picture.
So what inspired them to take their advice public?
Well, I ran out of golf balls. So I got nothing else.
Well, that, and perhaps to remind us
that it's okay to make fun of yourself, and it's okay to connect with people.
Well, we love you guys. You're awesome.
All right.
Thank you.
So while their advice may vary in success,
if they're out shopping by themselves, they're either one, hungry, or two, they have some money.
they are honest.
And if you have a question that we don't know an answer to, we'll just make stuff up.
And honestly, right now, we could all use a laugh.
That's true. We just want people to come out, have a good time, enjoy themselves, have a good laugh at our expense.
There's enough clashing of the minds around it. This is a chance to say, hey, you're a jerk, I'm a jerk. So let's now that we've got that settled, how you doing today? Look somebody in the eye and say, how you doing?
So maybe these old farts have got it all figured out, after all.
Come on, you want to be me. Face it, you want to be. You can get some of this. Come on.
So this is the portion of the show where our producers like us to talk about the story we just watched. I honestly have no idea what to say about those old farts.
If you can avoid it, don't step in it.
There you go.
No truer words were spoken.
No doubt about that.
Yeah.
All right, that's it for us here on Investigate TV Plus. I'm Lee Zurich.
And I'm T. Chappelle. Thanks for watching. Next time on Investigate TV Plus, a scam growing across the country that can catch you completely off guard.
Had you ever heard of SIM swapping before it happened?
I'd never heard of this before.
An in-depth look at SIM swapping and how hackers are locking people out of their virtual lives.